Hello, dear gentlemen. They say that after 60, your desire fades, intimacy becomes a memory rather than a need. But I want to ask you this. If that's true, why do millions of men still feel the urge, and why do they feel guilty about this perfectly natural thing? I've talked to men who have built careers, raised families, and yet they sit before me, ashamed of an act as normal as masturbation. They're not sure if they should do it anymore, or how much is too much. I'm Dr. James. For over 30 years, I've helped men regain their strength, vitality, and confidence by answering their most personal questions with honesty and science. Today we're going to talk about a very important topic. How to make masturbation not an escape, but a real health tool after 60. In this video I'll share 3 golden rules to turn masturbation into a restorative act, and most importantly, how to recognize the warning signs that you've gone too far, even if your body is still responding. Don't leave, you need to hear this, for a better and more quality life. The truth about ejaculation frequency and prostate health. The prostate is an important organ in the male body, and its health is always a top concern, especially as men age. One of the topics that is often discussed but not clearly stated is the link between ejaculation frequency and the risk of prostate diseases, especially cancer. Here are some scientifically researched facts about ejaculation frequency and its effects on prostate health. 1. High frequency and prostate cancer risk. Many large studies have shown that frequent ejaculation is associated with a reduced risk of prostate cancer. Harvard featured study. One of the most widely cited studies is the Health Professionals Follow-up Study by Harvard researchers. The study followed nearly 32,000 men for about 18 years and found men who reported ejaculating 21 or more times per month had about a 20% lower risk of developing prostate cancer than those who ejaculated only 4 to 7 times per month. This association was observed across a wide age range, including men in their 20s and 40s. Hypothesized mechanism. Although the exact mechanism is still being studied, scientists have proposed several hypotheses. Detoxification. Ejaculation helps flush out potentially cancer-causing chemicals, inflammatory substances, or infectious agents that build up in the prostate, the prostatic stasis hypothesis. Biological changes. Molecular studies have shown that frequent ejaculation can affect the expression of genes and biological processes involved in the production of citrate, a component of semen, while low citrate levels are a feature of prostate cancer. 2. Frequency and other prostate issues. Adequate ejaculation frequency is also beneficial for overall prostate health, in addition to reducing cancer risk. Reduce chronic prostatitis. Many studies and urologists encourage men with prostatitis to have sex or masturbate. Ejaculation helps reduce the unpleasant symptoms of chronic nonbacterial prostatitis. Maintain blood circulation. Regular ejaculation helps maintain healthy blood circulation and function of organs in the reproductive system, preventing stagnation. 3. The golden number and practical recommendations. While the 21 times a month figure is often mentioned, it is important to remember that this is a research threshold, not a hard medical rule. Studies show association, not absolute causation, and some smaller studies have shown conflicting or unclear results. Ideal frequency based on age. Average ejaculation frequency will vary with age. For older men, e.g., over 50 to 60, 21 times a month may not be realistic or consistent with energy levels, hormones, and personal desires. General recommendations. Minimum. Some experts recommend ejaculating at least once a week to support overall prostate health. For men over 60, a range of 8 to 21 times per month is considered a balanced rhythm, providing enough stimulation to protect the prostate without causing exhaustion or overloading the nervous system. 4. Important tips. Listen to your body. The ideal frequency is the frequency that leaves you feeling healthy, full of energy, and does not cause fatigue or psychological pressure. If ejaculation too often leads to fatigue, muscle pain, or a feeling of emptiness, it may be a sign of overloading the system. Overall factors. Ejaculation is not the only way to protect the prostate. A healthy diet, less red meat, more vegetables, maintaining a reasonable weight, and regular exercise are important factors that have been shown to reduce the risk of prostate cancer. Consult a doctor. If you have any concerns about your prostate health or the frequency of your sexual activity, consult a urologist for the most specific advice. Ejaculation frequency and other prostate problems. In addition to its widely studied link to prostate cancer, ejaculation frequency also has notable implications for other common prostate health problems, including inflammation and enlargement, benign hyperplasia. 1. Prostatitis. Prostatitis is a common condition that causes pain and discomfort in the pelvic area and urinary tract. Ejaculation frequency is thought to play a role in managing and alleviating the symptoms of this condition. Benefits of frequent ejaculation. Detoxification and inflammation reduction. Many urologists recommend that prostatitis patients maintain sexual activity or masturbation. Ejaculation helps clear secretions that have accumulated in the prostate and ducts. Long-term retention of these substances can contribute to chronic inflammation, especially chronic nonbacterial prostatitis. Reduce congestion. Regular ejaculation can help reduce pressure and congestion in the prostate, thereby relieving uncomfortable symptoms of the disease. Pain relief. After ejaculation, the body releases neurotransmitters that bring a feeling of relaxation, helping to reduce stress and pain associated with inflammation. Recommendation. For men with prostatitis, doctors often encourage ejaculation at least once a week, or as specifically instructed by the doctor, to support circulation and reduce symptoms. 2. Benign prostatic hyperplasia, BPH. Benign prostatic hyperplasia is a condition in which the prostate gland increases in size due to age, commonly found in men over 50 and causing problems with urination. The relationship between ejaculation frequency and BPH is more complex and less clear than that of prostate cancer. The role of ejaculation reduces stasis. Some theories suggest that frequent ejaculation can help maintain healthy circulation and function, preventing buildup that can contribute to cell proliferation. Negative aspects, organ fatigue. However, some unofficial sources warn that too much ejaculation can overwork the prostate, leading to temporary enlargement or promoting inflammation, indirectly affecting the health of the gland. However, this needs further scientific research to confirm. Medical facts. To date, there is no strong scientific evidence to support the claim that high ejaculation frequency can prevent BPH. The main cause of BPH is age-related hormonal changes, especially the hormone dihydrotestosterone, DHT, not a lack of sexual activity. Summary. While ejaculation is not considered a treatment or preventative measure for BPH, it can still support prostate health by reducing inflammation and maintaining circulation. 3. Balance frequency. The key to health. Prostate health and overall male health both benefit from a balanced and intentional ejaculation frequency. Avoid too little. Infrequent ejaculation can lead to semen retention and an increased risk of chronic inflammation, especially in older men. Avoid too much. Excessive ejaculation, especially when not accompanied by real desire, due to loneliness, habit can cause nervous system fatigue and energy loss, although not directly harmful to the prostate. Golden advice. The ideal frequency is one that matches the individual's needs and energy levels, resulting in a feeling of relaxation and well-being after release, rather than fatigue or emptiness. Maintaining a healthy lifestyle, diet, exercise remains the strongest foundation for long-term prostate health. Risks of ejaculation frequency. Too little and too much. Ejaculation, through sexual intercourse or masturbation, is a normal physiological function. However, in men, especially as they age, the frequency of this action needs to be balanced. Maintaining a frequency that is too little or too much can have certain consequences for physical and mental health. Risks of underuse, stagnation. When ejaculation occurs too infrequently, e.g., less than 4 to 7 times per month, the prostate may face a number of problems. 1. Increased risk of prostate cancer. Scientific evidence. Large studies, such as the Harvard study, have shown that men who ejaculate more frequently, about 21 times per month, have a significantly lower risk of prostate cancer than those who ejaculate less frequently. Stasis mechanism. The leading theory is that low ejaculation may lead to stagnation of secretions in the prostate. This stagnation may allow for the accumulation of potentially carcinogenic chemicals or chronic inflammatory substances, thereby increasing the risk of cell mutation. 2. Chronic prostatitis. Accumulation of waste. Low semen release increases the likelihood of fluid and metabolites accumulating in the prostatic ducts. This stagnation is considered a risk factor contributing to the development of chronic nonbacterial prostatitis, a condition that causes persistent pelvic pain and discomfort. 3. Reduced blood flow. Lack of pump ejaculation is a mechanism that increases blood flow in the prostate and pelvic region. Too low a frequency may reduce local blood pumping, affecting tissue health. 2. Risks of overuse, overstimulation. While frequent ejaculation is beneficial for the prostate, overuse, especially in older men over 60, can cause energetic, hormonal, and psychological risks. 1. Nervous system and psychological disorders. Brain reprogramming. When ejaculation becomes a daily habit or multiple times a day, especially to cope with loneliness, boredom, or stress, emotional escape mechanism, the brain can reprogram the reward system, dopamine. Dependence. The brain will seek a quick hit of dopamine, making the action an unconditioned reflex rather than a choice based on real desire. Emotional numbing. Excessive behavior can dull the ability to feel true satisfaction and lead to feelings of emptiness, emotional numbness, or disconnection after release. 2. Exhaustion and hormone imbalance. Energy depletion. Although the body produces sperm continuously, each ejaculation is a major neurochemical event, consuming energy, zinc, and other minerals. Slow recovery. In older men, the recovery time for the nervous system and hormones is longer. If the frequency is too high, the body does not have enough time to regenerate. Hormone impact. Overstimulation can increase the hormone prolactin, a hormone that inhibits arousal and causes fatigue, and prevent testosterone levels from fully recovering between sessions, leading to chronic fatigue, decreased physical strength. Brain fog, decreased concentration. Decreased real desire over time. 3. Decreased sensitivity. Sensory blunting. Overstimulation and frequent stimulation, especially with strong or rough techniques, can desensitize the nerve endings in the genital area over time, making orgasm more difficult or less satisfying than before. Conclusion. The key is balance and awareness. Men need to see ejaculation as part of an overall health strategy, not as a means of escape or an obligation. Science supports moderate frequency, 8 to 21 times per month for older men, to protect the prostate. Psychology warns that overstimulation can weaken the mental connection and physical energy. Listening to your body and maintaining a rhythm that brings relaxation, satisfaction, and energy is the best way to support physiological health at any age. Healthy masturbation after 60, maintaining connection and health. At age 60 and beyond, men's bodies and physiological needs change a lot. Masturbation is not only a physiological act but also an important part of maintaining mental health, emotional health, and prostate function. However, this act needs to be done in a healthy, conscious way and respect the changes in the body. Here are the principles for practicing masturbation in a beneficial and healthy way after age 60. Changing purpose. From escape to connection. After age 60, masturbation should change its purpose from seeking a quick hit of pleasure or escaping loneliness and boredom, to an act of caring and connecting the body. 1. Mindful masturbation. Don't rush it. Avoid doing it in a rushed, or chore-like manner. Take your time, think of it as a slow conversation with your body. Focus on the sensation. Instead of focusing solely on reaching orgasm, pay attention to the entire process, your breathing, the relaxation of your muscles, and the actual sensations of your skin. This helps strengthen the mind-body connection. Environment. Choose a quiet space, free from distractions like work, TV, or your phone, to increase focus and reduce stress. 2. Control your intention. Don't let your habit control you. If you find yourself masturbating just out of boredom or to relieve anxiety, it's likely becoming an escape mechanism. Take a moment to ask yourself before you begin, what am I really looking for right now? If it's an emotional connection, a walk or a phone call to a friend might be a better solution. 2. Adjusting technique and frequency. The body in its 60s needs more gentleness and recovery time. 1. Gentle technique. Reduce pressure. Nerve endings in the genital area may become more sensitive or vulnerable. Avoid techniques that are too rough or too much pressure, which can dull natural sensitivity over time. Relax. Use lubricant if necessary to reduce friction. The goal is gentle, slow stimulation, giving the body time to react. 2. The recovery principle. Ideal frequency. A safe pace is usually between 8 and 21 times per month, about 2 to 5 times per week, depending on your condition. This is the range that supports prostate health without exhausting the nervous system. Rest time. Try taking short breaks, e.g., 2 to 3 consecutive days between masturbation sessions. Like a muscle break, this gives the nervous system and hormones time to recover, thereby increasing sensitivity and satisfaction the next time. Pay attention to after ejaculation. If after ejaculation you feel tired, irritable, brain foggy, or sleepless, it is a sign that your body needs a lower frequency and a longer recovery period. 3. Support hormone and energy recovery. Healthy masturbation must go hand in hand with taking care of your body. Supplement nutrition. Ejaculation depletes the body of small amounts of zinc, magnesium, and other minerals. Ensure a nutritious diet, and consult your doctor about taking supplements to support testosterone recovery and balance. Increase blood circulation. Physical activity. Regular exercise, especially cardiovascular exercise, helps increase blood flow to the pelvic area and supports erectile function. Hydration. Drinking enough water helps support the body's overall recovery process. IV. Remove psychological barriers, no shame. Normalize. Masturbation is a natural part of male physiology and is nothing to be ashamed of at any age. It is a way to maintain sexual function and connection with your body. If you have a partner, view masturbation as a supplement, not a replacement, for intimacy. Being upfront and open with your partner about this often helps alleviate feelings of guilt and can lead to deeper understanding and intimacy. In short, healthy masturbation after 60 is not about quantity or performance. It's about the quality of connection, respecting the body's new rhythms, and using this act as a tool to support prostate health and maintain vitality and self-awareness. Ultimately, healthy masturbation after 60 isn't about quantity or accomplishment. It's about quality of connection, honoring your body's new rhythms and using it as a tool to support prostate health, combat loneliness, and maintain vitality. True power at this age doesn't come from trying to be the man you once were, but from celebrating the man you are now, wiser, more conscious. I want to hear from you. How have you adjusted your rhythms as you move into your 60s? Comment 1 if you've found balance, or 0 if you're still searching. Your feedback helps me better understand what you need. If you're a man over 60 interested in living with full energy, confidence, and purpose, hit the subscribe button and turn on the notification bell. This ensures you never miss a piece of science-backed advice created just for you. And if you want to learn more about how testosterone changes after 60 and how to optimize it naturally, check out my next video right here. Thanks for watching, and I'll see you next time.